The gentleman from Georgia is recognized for 5 minutes.
Thank you, Mr. Chairman. Dr. McCants, thank you for being here, and thank you for what you do for the children, particularly of our citizens. And we appreciate that very much. I know a lot of this hearing has gotten a little bit off base, but I want you to know that we appreciate what you're doing for our citizens here. I'm sorry to have to report to you that Georgia's not doing so good with mental health services. In fact, we rate about 47th out of 50, and that's one of the things that bothers me. And in fact, it's estimated that we have less than 20% of the beds that we need for mental health services in the state of Georgia as well. Particularly when it comes to childhood mental health, we've got 159 counties in the state of Georgia, and only 76 of them have a license, or 76 do not have a licensed psychologist. We've got, again, 159 counties, 52 of them have no licensed social worker. All of these figures are alarming to us, and alarming to me in particular, because of the fact that in the state of Georgia, for those children between the ages of 15 and 19, the second leading cause of death is suicide. And for those between 10 and 14, the third leading cause of death is suicide. So all of that leads me to ask you, Cures reauthorized the Children's Mental Health Initiative, and that provided a lot of grants and a lot of assistance that we are very appreciative for. But I just wanted to ask you, particularly in the state of Georgia, we have a lot of rural areas, particularly in South Georgia, in my district, a lot of rural areas. And I'm just wondering, how do we get services to those areas? Any suggestions on how we can improve services there?
So SAMHSA has supported two types of integrated care programs. One is where behavioral health providers would be able to be part of a team in a primary care program, such as a federally qualified health center. The second way is through programs such as our certified community behavioral health clinics that bring primary care directly into a behavioral health setting so that a person can easily access all the care and services that they need in one setting. SAMHSA, as you know, has limited funds. We do demonstrations. We work closely in terms of establishing those demonstrations and then doing more technical assistance and training and try to establish those programs on a national level. We talk with our colleagues at the Centers for Medicare and Medicaid Services.
What about telemedicine? Is that something, telehealth, telemedicine, is that something that we should be focusing more on?
Yes, and I was just about to get to
I'm sorry.
So yes, telehealth is a very important piece of it, particularly for areas that have a lot of large rural communities.
Right.
Telehealth can really extend the reach of a practitioner who may be in a more urban area, but can, and so the Department of Health and Human Services has a committee that is working on telehealth guidance for the states. And in addition to that is working with, for example, the Drug Enforcement Administration around issues of prescribing so that we can utilize those telehealth providers to the very best extent.
Are there grants specifically for that, or are they just included in the regular grants that you can use it for that purpose?
We have at SAMHSA part of a larger grant program that our telehealth services come from, and I believe that other parts of HHS, such as HRSA, have specific funding for telehealth services.
Right. Another thing I want to talk about real quickly is the opioid addiction and the funds that have been going there, the grants that have been going there. We've been very fortunate that the Georgia Department of Behavioral Health and Developmental Disabilities has gotten over almost $12 million. And I want to report back to you because I've been a part of some of these programs. It's working well and it's being utilized well. In fact, I've been one of the cities, and I want to give them a shout out, the city of Pembroke, Georgia, in my district in Bryan County has been very active in this and has implemented a number of programs that have, media campaigns, school partnerships, a number of programs that have been very successful. Can you elaborate just very quickly on what else we might be doing with that?
So for the opioids, the opioids crisis is one of Secretary Azar's priorities. There
And this committee's priorities as well.
Yes, and we are very grateful to Congress for the increase in funding to address these issues. So what we have to do is to work very hard to integrate substance abuse treatment, opioid addiction treatment into primary care settings, in addition to having specialty care available. We know that people find it very difficult to access care, and so we want to broaden the number of providers that are willing to engage in the care and to use innovative practices such as telehealth. This is why we're working with the Drug Enforcement Administration to make it possible for a clinician to have a greater reach and to reach Americans in those rural areas that have such difficulty accessing.
Great. Thank you again for your work, and I yield back.
Chair